Now, you guys should just know that the whole world is kind of like tilting towards preventive medicine. All right, that's like prophylactic medicine. All right, so the world is tilting towards, okay, you mustn't actually have a disease condition before you start treating and all that. All right, so you need to actually learn how to prevent. Okay, so when you prevent, you actually reduce the influx of people that we have in the hospitals every day. All right. So on this basis, let me show you guys how to prevent lung cancers. Okay. So we have it on this picture. I'd like us to go through this picture. We'll go to the right up, go to another picture. All right. So with these three materials, I know that you guys will actually know the possible preventions, okay, towards lung cancer. Okay, so this one is the first type of prevention is what? Don't smoke. Okay, if you have started smoking, you need to stop. All right, then this one is basically for people who don't smoke. All right, so even if you don't smoke, just make sure you eat a wide range of vegetables, fruits, whole grains, legumes, and all that. All right, then exercise regularly. Play basketball, badminton, golf, anything. Run around the street and all that. All right? Always exercise. Then check your home for radon. You know that one of the risk factors for this is what? Radon exposure. I think it's radon gas exposure, something like that. All right. Then avoid secondhand smoking. Secondhand smoking is more of like, okay, you have this wild type of friends. You don't actually smoke, but they take you to parties where people are smoking shisha, weed, and all that. So as another person is smoking, you are inhaling. Okay. So that's secondhand smoking. So you should avoid this too because it's still deadly. Okay. It's still smoking. So the first one I told you guys, avoid cigarette smoking. So do not start. Now stop if you have started. And don't even be a passive smoker. Don't say I smoke once in a month, like the way we like clock patients in the hospital and they're saying like they don't even do it much. They just do it once in a week. Okay? Don't even be a passive smoker. Just to stay clear of the most what deadly risks for what lung cancer. Then you should check your environment for what radon, so you don't be exposed to radon. Now you should wear protective or safety measures in risk occupational environment. Risk occupational environment is more of like, okay, you work at an industry where you guys deal with, let me say, a bread factory. You guys deal with all those baking, so there's smoke everywhere. So you could just cover your nose with a nose mask or a special mask for that, right? Then you should screen for lung cancers in people in risk groups, like, okay, people that smoke, people that stay in environments where there's much smoke, people that work in factories and all that. All right, so you should always screen for this so that if somebody is at the verge of having a lung cancer, you can advise them to change a job that they are doing. Okay, you advise them to change a job to another type if they don't want to have this lung cancer. Okay, so as a summary, avoid tobacco smoking, eat a healthy diet, get vaccinated against lung cancer. Or it could be that, yeah, are vaccinated against some other microorganisms that might cause infections in the lungs. Infections in the lungs might lead to lung cancer. Do you understand? So just get vaccinated, exercise regularly. They should monitor air pollution. Okay. So these are everything you need to know about what prevention of lung cancer or what reducing the risk of developing lung carcinoma. All right, so I want lung cancer and lung carcinoma to actually come in. All right, because such words are kind of like power on YouTube. See you guys.